I started treating people with severe degenerative disc problems in the spine back in 2004, 2005. It happened because I had several patients that were referred to me through other practitioners, other doctors, and I ended up eventually sending them out for surgical consults. And at that particular time in my career, I had been hearing about this technology, and I wanted to understand more about how it could help people avoid spinal surgery. And so since 2005, when I first purchased this machine that's behind me, it's called the DRX 9000, I have been treating people non-surgically for disc-related problems. A lot of disc-related problems start off as more manageable conditions. And so there's a progressive degeneration that happens in the spine where, when we're born, our joints are nice and clean and smooth, and there's space for the nerves to exit the spine and transmit through the body. But what can happen is that the bones start to become uneven and they get jagged edges, and there's inflammation in and around the spine, and that starts to cause a breakdown in the spine. So, this technology is really most effective for people who have degenerative disc disease, spinal stenosis, herniating and bulging discs, discogenic pain. It can be extremely successful in helping to remove the pressure off of the nerve and off of the spine to allow the disc to begin to heal. Historically, from a medical perspective, the treatment of the disc is done pharmacologically. So, they'll throw pain meds or injections at the problem. They'll inject, people hear about getting in epidural injections. And if that doesn't work, usually they'll start with, say, physical therapy, but to me, that's all backwards. You really don't want to do therapy on the front end, because when there's already aggravation in the tissue, you don't want to go and aggravate it more. And a lot of times when you're moving the body around, you're doing exercises or stretches or strengthening or anything that you're doing prior to treating the disc, you may end up aggravating the problem and making the problem worse. So anyway, nonetheless, in the medical world, they tend to go from physical therapy to pain meds to injections and then to surgery. And a lot of what I've done in my own life is to help people to avoid spinal surgery, because I felt like, there are some basic things. You can always have surgery, but there are some basic things that we can do in order to be able to preserve the body so that it doesn't just keep deteriorating over time. Some of these I've talked in previous videos, and we've talked about posture, right? Really lengthening through the spine, getting pressure off of the spine, getting the body into a more vertical position so that when gravity is moving through us, it helps to disperse that pressure throughout our body. The second thing is alignment, which is, it's like sometimes I come in and people's hips are all twisted, or there's scoliosis in the spine, or there's some sort of bend, or the pelvis is tilted, or there's a collapse in one foot. There's all sorts of things that can happen. In fact, I've been helping a guy who lives up in Canada with a spinal condition because he's had chronic pain and he's not getting any answers. And we've mostly been just messaging back and forth, but he's got a bit of what we call flat back syndrome, which means that instead of there being like a natural curve to the spine, that spine is nice and straight. And when the spine becomes straight like that, there's too much compression on the spine, and eventually somebody can end up in my office simply because they're not getting answers and it's not being evaluated correctly. But you have to look at posture means positioning, and when the positioning of a person's body is not in the right place, it's going to cause a more rapid deterioration of the joints of the spine and the connections with the nerves. So, when I talk about avoiding spinal surgery, I say that to people even who are not in a position where they're trying to avoid spinal surgery. I think that the time to start avoiding spinal surgery is now. is earlier, is last week, is last month, is last year. You have to think about these things before they happen, not once you're already on top of the problem. And part of, living a more wellness lifestyle and being more kind of thinking about the way that your body is aging is that long before your body gets to the point where it's all broken down, there are things that you can be doing. And if you're not doing them, I can't really help you. But part of my purpose for doing these videos and answering some of these questions is simply because I think that there's a lot of things that people can avoid that they literally doesn't cost you any more money to focus on your posture. You have to pay attention to it. It doesn't cost you any more money to put ice on painful areas. Those are two basic things, but there's sometimes we need help. There are things that obviously we can do ourselves, and then there's also things that we need help with because we can't do everything ourselves. Just in the same way that you go to a dentist to clean your teeth. Why do you do that if you're already brushing and flossing your teeth? Why do you go to the dentist? Because they can see things below the surface of the tooth that you can't see without an x-ray, without an exam, without some sort of intervention. So there are those things that we do ourselves, then there are those things that we need help with. And so chiropractic is one of those things. This table back here is called axial decompression, and there's different methodologies and treatments that we do in our office to help people who are having severe disc-related problems. Now, not only do we want to stop the process of inflammation and degeneration in the spine, we need to, at the very least, we need to slow it down, because invariably these problems will get worse over time. They don't get better on their own, especially if there's already deterioration. And I have a whole host of different people. I've got people with all sorts of conditions that end up needing to have more involved treatment, including the axial decompression, including chiropractic, including functional medicine, to help to restore the body. And you know what? These are different services that we offer in our office, and I want to give plenty of information for the people that are listening to these videos, because there are things that you can be doing right now to help to reduce the amount of pressure on your body, but you have to know what to do. So we talked about posture and alignment. We want to make sure that our alignment is good, because our ligaments hold our bones together, and when our body is breaking down. In fact, I saw a young man today. He's 18 years old. He's a power lifter. And one of the things we talked about was that you can be lifting more weight. Like if you're lifting weights and your muscles get big, you can have more weight on the frame of your body than your joints actually can handle. And that's part of what's happening with him. He's lifting heavy weights, but it's causing pain in his knees, pain in his shoulders, pain in his back. Sometimes people are overtraining, and I've been there before too. When I was younger and I was physically active, I would train and not understand that there was this wear and tear that was happening on my body. But it's cumulative over time, and so when we're doing something repetitively over a long period of time, say like running or jumping or doing, even if you're doing you're doing yoga, you're doing CrossFit, you're doing Orange Theory, you're doing something repetitive, you're playing tennis. I was playing tennis, and I messed up my right shoulder because of the repetition of serving and ground strokes and all the things that I was doing during that time in my life. Running by itself is not a great activity. We want to cross train. So there's more to this conversation, but mainly what I wanted to talk about was about the effect or the resources available to you, such as axial decompression, such as chiropractic, such as getting an x-ray and an MRI on your body so that we can see exactly what's going on in there, not guessing. We don't want to guess because we can see from the outside, but in order to be able to really understand, you have to look on the inside. And some of those people we send out for nerve conduction studies, which measures the speed that the nerve travels down the arms or down the legs. It helps us to understand what's going on. But the process of deterioration and degeneration is cumulative over the course of our life. It starts when we're younger, and it builds up and it builds up and it builds up. We want to slow that down. And if you take a look at an X-ray or an MRI of an older person, when I say older, I mean who's in their 50s, 60s, 70s, 80s, 90s. As we get older, our body changes. And if you're not aware that your body's changing, injuries that you had years and years ago are going to start to catch up with you. And a lot of times it happens in the knees and the hips and the shoulders and the back. It happens all over the body. But we can prevent that from happening. There's treatments that you can do. Even if you're having pain, there's treatments you can do to make yourself better. But it's going to take an expert. It's going to take a professional to help you to reverse that and to get you on the right track. I'm Dr. Brad Wolf. We're talking here about disc problems and herniated disc and bulging disc and disc repair. I get a lot of questions about this, and I hope this helps you. If you have questions, put a comment below the video, and I'm happy to try to get back in touch with you and help you the best way I can.